Now, according to the World Health Organization, malaria infection remains the biggest deal for African countries. And the World Health Organization as well has estimated that in Kenya, about 70% of the population are at a risk of getting this disease. Now, mothers, specifically pregnant mothers and children, are at a risk of getting malaria. And despite the fact that this disease can be prevented and treated, then the issue of anti-malarial drug resistance remains the biggest challenge into eliminating this disease. And as Kenya joins the rest of the world in marking World Malaria Day on Wednesday, the 25th of 2018, the question remains how, or is there a way that this disease can be eliminated? But yes, there are some good news because there is an anti-malarial drug by the name KAF-156 that is on trial, that is meant to eliminate this disease, especially for African countries. Today on My Doctor Show, we talk about malaria in children and why is this disease prevalent, or why are children at a risk of getting malaria. In studio, we have Victor Kibe. He is an infectious diseases specialist. He will be telling us what causes malaria and how it can be treated. Remember, as always, you're welcome to be part of My Doctor Show today. Talk to us. The SMS line is free of charge. 20268 is the number. Just ask us a few questions and we'll be glad to respond to your comments. You can also call us live through the number that will be displayed at the bottom of your screen throughout this show. But just before, I could ask you to sit back, relax, and learn from this exciting show ahead. As usual, let's have a look at what's coming up.
So the importance of this drug is this. We hope that the drug will for example, reduce the number of days that we need to treat malaria when somebody is sick. Then the second thing is we are looking for alternative anti-malarial drugs, just in case resistance becomes a problem in our society. Then we will have something that we can use to treat as an alternative. So those are the most important reasons why this drug, why we are doing the study on this particular drug. So death mostly occurs in children or pregnant women when they have malaria, or adults who do not have continuous exposure to malaria. Like, for example, if you come from Nairobi, where malaria is not a common problem, then in the world of malaria, you are like a child because your immunity is not as much. Therefore, you are at higher risk. And when you get malaria, death can come because of what we call complications that malaria causes in people. It could include things like severe anemia, which we commonly see. It could involve what we call cerebral malaria, where you have malaria that has affected your brain. It could involve things like acidosis. There's some acidity that develops in your bloodstream because of malaria. So it could be, you could become, your blood sugars could be very low, what we call hypoglycemia. You could develop renal failure. So there are many things, complications that can make somebody die of malaria. You could have convulsions and so on. We recommend that when a child, for example, has fever, within 24 hours, they need to go to the nearest health facility. Could be a hospital, health center, or even a dispensary, so that they get diagnosed, because now there are rapid diagnostic tests that are available, or microscopy, and then they get treated. That's the recommendation. Then the outcome becomes pretty good. Yeah.
Welcome back. You're watching My Doctor Show, and today we're talking about malaria in children. What are some of the symptoms and how can it be prevented? In studio we have Dr. Victor Kibe. He is an infectious diseases expert. He will be telling us especially where we are as a country in terms of managing or even the moves that we have made to eliminate this disease. You're welcome to be part of this show. My name is Purity Museo. Talk to us. The SMS line is free of charge. 20268 is the number. The number to call us live is displayed right at the bottom of your screen. Welcome to My Doctor Show, Doc.
Thank you.
Thank you so much for coming.
Thank you.
Yes,
thank you for having us.
Thank you. You're welcome. And before we get to what malaria is,
Yes.
Kenya will be joining the rest of the world tomorrow in
Yes.
marking World Malaria Day. Where can we say we are as a country in terms of the guidelines that we have set or put aside to eliminating this malaria disease?
Wow, thank you. Purity, for having me, and to our viewers, good morning. I would say that there have been a lot of concerted efforts in the fight against malaria, bearing in mind that this is not a new disease. It's been with us for ages and continue being a high cause of morbidity and mortality, not just to the pregnant mothers and the children under 5, but to the population at large.
Right.
And also it's good to appreciate that there is a lot of socioeconomic burden that comes with any disease. And of particular interest now that we are talking malaria is to know that it will definitely have a cost impact. And why I say this is when you realize that it is one of the 3 highest killer diseases, which has a lot of concerted efforts, both globally and locally, as a country level. And now that health is a devolved function, even at the county levels. So I would say that we've made good progress as a country in the fight against malaria. A few years ago, not long ago, like 10 years, malaria really used to kill. The prevalence was more than 20%. But we've seen a decrease in prevalence rates. The last indicator survey, which was conducted, I think, in 2015, showed that as a country, we are at a prevalence rate of approximately 8%. Of course,
From the previous one, which
yes,
was 11%.
Yes.
Right.
And I'm sure there are more studies which are going on. We may soon be getting new figures, even tomorrow as we celebrate.
Right.
That is from the Division of Malaria Control Program. Yes.
Yes, and let's maybe begin with the basics. What is malaria, you know?
Interestingly, malaria is a protozoa disease, infectious disease. That means I can infect you, you can infect me, or anybody else. And malaria is caused by a plasmodia. And there are 4 types of plasmodia. The most common, which is very prevalent in sub-Saharan Africa and also in Kenya, is called the falciparum, Plasmodium falciparum. The others, there is the vivax, there is ovale, there is malariae, but the most prevalent species that we've been seeing circulating around is the Plasmodium. What is important to understand is that contrary to what many people think, or what actually I think needs to be demystified, is that it is not the mosquito that causes the malaria.
What causes the malaria, Doc?
The malaria is an infectious agent. I think the right way to put it is that we, human beings, are the one who infect mosquitoes, and then mosquitoes transmit the malaria and continue infecting other people.
Okay.
Why is this so?
Yes.
Maybe just briefly to explain. When you look at the basic biology, what we learned in the primary school, mosquito is an insect, has 4 stages of reproduction.
Yes.
So when a mosquito is newly hatched, it does not have the plasmodia. So it is malaria-free. What now happens is that the plasmodia uses the mosquito as a vector.
Right.
Whereas the human being is the host.
We are the host?
We are the hosts. We
Okay.
human beings are the hosts. So the role of the mosquito in this case is just to transmit.
All right.
Yes.
And maybe, Doc, you could explain a little more. You're saying that we are the host for this plasmodium.
Yes.
Maybe how, okay, is it automatically found in a human's body, or are there contributors to having this plasmodium?
Okay, what has happened, Purity, is that we've had these agents, and we still have them, even today. But they do not always cause infections, because our immunity, especially when we have good immunity, good body immunity, then it means it is able to suppress not just the malaria, so many other agents which are circulating in the air. Could be found in the food we eat, the air that we are breathing, the water we are drinking. So malaria as a parasite has been with us and continue being with us for a very long time. And the reason why we are saying we are host is because I could be hosting the parasites, but I'm not getting infected with malaria. But when the mosquito does a blood meal from me, goes and infects or bites, for example, the high risk, a pregnant mother, then because the immunity is somewhat suppressed by the nature of their pregnancy, then they are at a higher risk of developing malaria. So what we are trying to say is that we live with malaria. It's part of us.
Right.
And especially in the high endemic areas, what we call the lake regions and the coastal regions, where the prevalence is as high as 27%.
Right.
Yes.
Are these sites the breeding sites for malaria, or why do we have the prevalence so high in lake areas?
Well, thank you for that question. And I think it has a lot to do with the environment. You realize that the lake region, the coastal regions, malaria is an endemic, as in it is there throughout the year, regardless of the weather patterns.
Right.
However, you realize that in some places, especially the highlands and the arid and semi-arid, the prevalence of malaria tends to increase during this season which you're experiencing, which is the rainy season.
Right.
Why is it so? Number one, the life cycle of the parasite itself requires some certain degrees of temperatures. For it to undergo what we call in medical terminology as the sporologic cycle, so that it is able to complete the cycle, so that it is able to become infectious. So what happens during the dry seasons, when we have less rains, means we have less breeding grounds for the mosquitoes, which means that the temperatures are also altered, so the replication cycle of the parasite is interfered with, and thus the prevalence. But then you realize in the coastal regions and in the lake basins, we tend to have a lot of what we call conventional rainfall throughout the year. And for that reason, also because of the water bodies, among other factors, there is an increase, or rather a prevalent degree of mosquito breeding. And the infectious agents now are able to complete their cycle under those temperatures. So that makes those areas to be highly endemic. The other areas, the ones I talked about, the low risk and the highlands, it is less. And central Nairobi is considered low risk with less than 1% prevalence.
Right.
However, it's important to know that because of a lot of, intercountry movement up and about, there are still so many cases of malaria being reported in Nairobi County, despite being one of the low. Though we attribute this much to, the movement being...
Or the
No,
movement,
the movement.
traveling in and outside the city.
In and outside the city.
Right.
We have one of the various places where Kenyans have become very good at doing business, the Southeast Asia, which is a high malaria prevalence countries. And also, as you realize, there's also cross-border movement between our neighboring countries, Uganda and Tanzania, Ethiopia. Yeah.
Okay, you're watching My Doctor Show, and right here today we are talking about malaria for children. Why are children at a risk of getting malaria? We have Dr. Kibe, Victor Kibe, whose specialization is in infectious diseases control. We've already looked at what malaria really is and what are some of the causes. We want now to look at some of the symptoms and the transmission. You're welcome to be part of this show. The SMS line is free of charge, 20268, and the call line is right at the bottom of your screen. Once again, in case you're joining us for the very first time, you're watching My Doctor Show, and my name is Purity Musel. Doc, you've talked about being caused by a mosquito, Anopheles mosquito, but you already say that we are the host for this plasmodium. Now, let's talk about the transmission. What happens in a person's body? You've said, so when a mosquito is biting me, the purpose is not to transmit malaria, but to get blood, right?
Yes.
So what happens exactly between the mosquito and the human?
Well, thank you. Thank you, Purity. That's a good question. Normally what happens is that the malaria parasite undergoes a cycle. Just like anything that reproduces would undergo a complete cycle for it to become, you know, an infectious agent.
Right.
Normally what happens is that we have what we call the merozoites and the sporozoites, the various stages.
Mm-hmm.
I would want to begin it from the point where I am the host, already infected with the parasite. Mm. And remember, mosquitoes do not choose who to bite and who not to bite.
Right.
In this case, I would want us to imagine a scenario we are in a highly endemic zone, like western part of Kenya. And maybe we are seated, a group of us. I am a host who is infected. Mm-hmm. So the mosquito will have, let's assume it's a newly hatched mosquito.
Right.
That doesn't actually have any plasmodium in it.
Mm-hmm.
So when it gets a blood meal after a skin bite on me, the next person it bites, what normally happens is it vomits so that it can get more.
Okay.
So in the process of vomiting, the content of the vomit is where the plasmodia gets transmitted.
Okay.
Now, supposing this mosquito was to bite you as Purity.
Mm-hmm. And maybe, Doc, before
Yes.
we continue, there's someone who's calling us. Can I cut too short and hear what they have
sure.
to say?
Yeah.
Okay, Farida, hi.
Hi.
Good morning.
Hi. I want to talk to the doctor.
All right.
Yeah, because I have been having my results.
Mm-hmm.
Hello?
Yes, I can hear you.
Yeah, I have been tested like twice
Okay.
in local dispensary.
Right.
And when they did my first test, it is kind of testing as positive.
Mm-hmm.
Now they do the testing. It is test as negative.
Okay.
Then they received my blood and they send it to Cambridge.
Mm-hmm.
The results from Cambridge, they came up as I'm negative. Now I'm pregnant, and I'm 7 months pregnant, and they did my test on December when I went for MTH, and the results were like the same. So they said they have to take my blood again to Cambridge, and the results.
Okay.
Now when I went back on my clinic yesterday, they had to do the test again for the second treatment again. The results were like the same. I have been having issues with these clinic sisters because they know they are like not trusting the results from Cambridge that I'm negative. They are using the results here that I'm negative. So I'm like confused.
Okay, we've lost her, but you've heard what she's having
Yes,
a different
yes.
concern. Maybe you're in a position to
Yes,
answer her.
maybe just to answer that caller is that we have various interventions in management of malaria, in as well as prevention. And if I were to speak about diagnostics, we have so many ways of diagnosing malaria.
Right.
But the ones recommended by the Division of Malaria Control is what we call the rapid diagnostic testing.
Right.
And then we have what is referred to as microscopy. It's actually physically, observing under a microscope, looking for the plasmodia in a blood slide, quantifying how many parasites are there in a field. That's actually the gold standard. However, because of resource limitations, an advancement in technology, we have now gone into a rapid diagnostic kit.
Right.
A rapid diagnostic kit, you can actually self-administer. It's just like a pregnancy kit. You just require a drop of blood, put it on the slide, and it gives you instant results.
Really?
Yes, that's how far technology has taken us. Because now this means where we cannot get microscopy because we do not have electricity power, or we do not have the laboratory technicians. The healthcare providers at the primary facilities can be able to test for malaria.
Yes.
Advanced testing is done in research institutions like she was referring to, one of them being Cambridge.
Cambridge, right.
And these are cases because for malaria we have to continually keep doing what you call surveillance. Remember, we are living in an era where even the mosquitoes are becoming brighter as we become brighter in fighting them.
Right.
So we have to have a confirmatory test. You may do a rapid diagnostic test, get a different result. Do a microscopy test, which might give you a different result.
Okay.
Then, of course, in the line of research and surveillance, we normally recommend that we send this to the national reference laboratories or to Cambridge, where they are tested further, so that we don't end up being caught in a situation where malaria is becoming resistant. We are not able to track its movement, because now that would spell a disaster for us.
Okay,
Yes.
and just before I know we'll be getting into details on detecting malaria, but can we look at some of the symptoms for malaria,
Yeah, sure.
especially for children, now that
Yes,
we're talking
yes.
about malaria in children?
Now, what I must say is that they are what we call common symptoms, which most of the infectious diseases will manifest with. For example, headache, fevers, elevated temperatures. But specifically for malaria, there are some telltale signs. Other than, fatigue, you may not be able really to, for a child to explain fatigue, I'm feeling fatigue, because we're talking about young babies.
Right.
However, fever is one of the key diagnostic symptoms for malaria. Refusal to eat, vomiting, and, excessive expression, because when fever comes, then the baby is quite uncomfortable.
Right.
They have not fed, which complicates things. They have a headache, which they cannot tell you that I have a headache. So actually now this leads to, the baby becoming uncomfortable and very flaccid and sick looking.
Right.
And now this is accompanied by, among others, being anemic.
Right.
A simple test of looking at their retina, you see that they are pale in appearance. In severe cases, the children will start convulsing, which is now a danger sign, because it means that the parasite has really taken toll on the white blood cells, which are the ones which are supposed to be defending a baby.
Right.
And remember the reason why we are saying children, especially under 5 years of age, are at a higher risk of contracting and getting malaria, complicated cases of malaria, is because the immunity is still growing.
Right.
The immunity is still growing. Unlike a grown-up person who can easily also be able to express to the clinician and tell them, this is what I'm feeling. More often than not, in the medical field, we rely mostly on the caregiver, who may not necessarily be the parent.
Right.
And it depends also with the period at which they were exposed to the baby. Remember, this is a disease which has an onset of less than even a day. It may not take you 3, 4, 5 days. It may take a shorter period. So these signs and symptoms need to be identified very fast. And that's why we say, in the practice, because of the manifestation of similar, in case of pneumonia or any other illness, the moment you realize that your child or even yourself, you are having severe headaches, unexplained fevers, the best thing is to seek medical help.
Okay.
Of course, very important to mention that seeking medical help is not just going into any clinic, you need to seek medical help from qualified professionals. Let them do the right diagnosis and initiate the right treatment. One of the guidelines in management of malaria, and that is according to the WHO as well as the Division of Malaria Control Program, is that all children presenting with high fevers and headache must be tested for malaria.
Okay.
And I think that's a good step in the fight against, because once it's misdiagnosed, then the child will most probably be brought back to the facility when, you know, the disease has become more severe, which means more in terms of cost of management. And sometimes the expertise may be lacking, which means you have now to refer this child to a higher level facility where they can be able to access treatment.
Okay, and when we come back, we want to have a look at how do we avoid having this misdiagnosis? How do we prevent malaria for children, and what is the future, especially for malaria? As at now, I understand there's a drug that you people are working on to completely eliminate the spread of malaria. That is what we'll be talking about when we come back. Remember, on My Doctor Show, that's the first part of My Doctor Show. We are talking about malaria for children. We are looking at some of the symptoms and how do you treat malaria for children. The fact that it's really hard to detect malaria in children. There are so many other diseases that come with the similar symptoms. So how do we go about it? We have Dr. Victor Kibe in studio to just break it down for us and give us the way forward. Talk to us. The SMS line is free of charge, 20268. The call line, when we come back, we'll also be receiving your calls. So just get ready to call us live through the number that is displayed right on your screen. We are going to take a very quick breather, but first let's have a look at some video that really explains in detail how bad malaria can be in the life of a child. Welcome back. Your questions really coming in really fast. Remember, this is the session that we will be having a look at your comments and your questions, and also receiving your calls live. Call us. The number that to use to call us live is displayed right at the bottom of your screen. The SMS line is free of charge, 20268. We will be having a look at some of the vaccines there is for preventing malaria. We'll also be looking at the treatment and the future of malaria. Talk to us. The SMS line, once again, is free of charge. 20268 is the number. But before we could have a look at our last session of My Doctor Show, let's have a look at the segment for home remedies. Welcome back. You're watching My Doctor Show. This is the last part of My Doctor Show. Remember to talk to us. The SMS line 20268 is the number. We are talking about malaria in children. Why are children at a risk of getting malaria, and how do we prevent that? Welcome once again to the second part of My Doctor Show, Dr. Kibe.
Thank you.
Yes, we earlier on talked about what malaria is, what are the causes and the symptoms. Can we get now to diagnosing malaria for children?
Thank you. Like I had mentioned before, diagnosis of malaria is regardless of whether it's a child or it's an adult, remains the same. Because we are talking about technology advancement, where we've gone ahead now to rapid diagnostic testing.
Right.
And the beauty of rapid diagnostic testing is that it does not require a lot of resources. The current RDT kits, as we call them, can actually be even used at home. That means it has taken the level of diagnostics to, that level where, with good education on how to use the kit, anybody can actually perform the test. However, we are not advocating for, self-testing
Right.
as it is, and especially because of maybe issues to do with quality and standards, misinterpretation of results, which may lead to misdiagnosis. But what we are saying is that we have the advancement in technology and bringing rapid diagnostic testing has taken the care. Remember, we are talking more primarily about prevention than curative.
Right.
So we are able to test more at even the lower levels. We have people we call community health volunteers who are meant to be a link between, the community level at the family level to the primary health care, which according to our system of what we call KEF, Kenya Essential Package for Health, the first level of care is actually a dispensary. And then we go on a health center, hospital setup, all the way to a referral institution.
Right.
So basically we have two primary tests used for diagnosis. We have a rapid diagnostic test kit, similar to the one that commonly people are familiar with, the HIV test kit, although they are now different. And then we have microscopy, where a blood slide is taken, a smear is prepared, and then that slide is actually observed in a laboratory setup under a microscope to diagnose. The beauty of microscopy is that we can tell which particular species of malaria it is.
Right.
And what is the quantity. You're able also to quantify the number of parasites. But basically, both for children and for adults, diagnostic tools remain the rapid diagnostic testing and the microscopy.
Right.
Yes.
And earlier on you talked about misdiagnosis when it comes to treating malaria. Maybe you could take us through the treatment for malaria in children. Or you said it's both the same.
Yes.
So what's the treatment for malaria like?
Remember, we are fighting a common parasite.
Right.
The only problem is that children at a higher risk
Yes.
because of development of the immunity, and also especially again the pregnant mothers. And what are they pregnant with? The baby.
Yes, and someone was asking, why are pregnant mothers at a risk of getting malaria?
What normally happens, and what we need to also as healthcare providers educate our community on, is that pregnancy by itself, conception, and the baby starting to grow means that the demands for the mother's immunity are being shared among two. That definitely decreases the immunity of the mother.
All right.
And once now the immunity is slightly compromised, then it means you are at a higher risk not just of malaria, but technically speaking, but any other ailment.
Okay.
And that is why pregnant women are, we take care of them as a cohort, because these are not sick people. Pregnancy is not a disease, but they make them prone, and susceptible to ailments. And, and that's why we see even diabetes, what we call gestational diabetes. It just comes when you're pregnant, and then,
Okay, maybe we can talk about the treatment very fast, because there's so many questions on prevention. But before then, let's pick one question.
Yes.
Are there, resistance, we'll be talking about it. Thanks for the show. My question is, if I have been infected with malaria, can I infect my child who is 1 year old? I'm Njue from Ruaraka.
Like I said, malaria, the mosquitoes do not choose. It does not mean that you are able to, infect through, sharing items or feeding. No.
So the mother is asking, because she's breastfeeding, now that she's infected, is she able to infect to the child who is 1 year old?
Through breast milk, no.
Not
it has
possible.
to be through a mosquito bite.
Okay.
Yes.
Okay. Let's get to we've talked about the treatment, we are done about the treatment, but most importantly, what are the key factors that contribute to the prevalence or that increased chances of an area or people getting this disease?
Primarily, I would say, remember, we are talking about two things. There is the vector, the mosquito, and there's the host, the human being.
Yes.
And in most cases, if the human being does not check the vector, then the vector gets you off guard. What do I mean? For example, we've been experiencing, rains that our and geographical pattern did not expect at this particular time of the year, because we expected them around this month actually. So normally what happens is that, like now when the rains have increased, definitely the breeding sites also increases.
Okay.
So as a host, as a human being, it is my responsibility to ensure that the grass around my compound is cut. The water collecting vessels have been...
Which are the sites for the vector?
Which are the sites where... What I'm saying is that we may be contributing to the vector. If you're not keeping your compound clean, there are water harvesting containers strewn all over the place.
Right.
You are not sleeping under mosquito-treated nest, then you increases the chances of the vector breeding and of the vector transmitting the infection. Now, when it comes to the other side of the vector, I think it's important to say that one of the best interventions we've had to that effect is the residue spraying, insecticide spraying, so that we try and interrupt the life cycle of the mosquito so that it is not able to, breed to full cycle and to cause the transmission. Recently, there is a technology that is being introduced, what we are calling the larvicides,
right,
where we now don't target the mosquito as it is, we target one of the stages of its reproduction, so that we inhibit that, so that we try and reduce the vector, the number of vectors.
Someone is asking, let's now get to the resistance, the anti-malarial drug resistance, because there are so many questions. What are some of resistant effects to malaria drugs?
I must say that, first of all, it's good to get the correct position, is that studies are ongoing. We cannot yet say that we have malaria resistance. What is being suspected, and studies which has been done in Southeast Asia have shown that there is a high likelihood of the parasite developing resistance. However, it is not yet documented. And that's why we are saying we need to come up with more innovative ways of tackling the entire thing. One of them is coming up with larvicides, which intervenes. The other thing is development of a vaccine. We also need to think of new drug pipelines. But as it is, the drugs that are recommended by WHO, they are called artemisinin combined therapies. Very common being what we commonly know as AL, artemethyl lumefantrine. And I can tell you, Purity, and to our viewers, these drugs have been proven to be 98% effective.
And why do we have to have recurrent cases? Why do I have, once I'm treated for malaria, after some times, I have the infection again? Yes,
there are several contributing factors. Of course, you realize that if we are not able to achieve what we call the therapeutic response, then the chances of reinfection. And why are we not getting 100% therapeutic response? It could be contributed factors by substandard drugs, which we know are there in the market, which of course now, if they are substandard, means they are not giving you the desired therapeutic effect. There are issues to do with adherence of the medication. You take antimalarials for 2 days, you feel better. Of course, more often than not,
you stop.
You stop it at that.
Right.
Especially in children, now that we are discussing matters children, vomiting is very common, or jerking. So if you just administer the medicine and then coincidentally or by bad luck, the baby, tends to vomit off, then again you're not achieving the optimal levels.
Right.
And actually this leads now to what we call treatment failure.
Yes.
And when you get treatment failure is what leads to resistance, because you are continuously exposed to suboptimal therapeutic response doses.
Right.
Yes.
And Doc, do we have a different dose for children? Because from what I know is that these tablets are really bitter. Do we have an option for kids, or they're the same drugs that the kids use?
Now, basically the drugs are the same. What we have is the dosage is different.
Okay.
For children, malaria dosage is done based on weight. We have to weigh the baby, or even the adult, of course, past a certain weight, the dosage is the same. But what I must say in response to the issue of the drugs being bitter is that there have been intense, deliberate research efforts by all partners and stakeholders in the fight against malaria to come up with baby-friendly formulations. And as it is, we have what we call dispersible tablets. You just, take the tablet, disperse it in a small amount of, milk or water, and then it is palatable, meaning that, flavors and these other experiences have been put so that the baby can, that is one.
Right.
Secondly, the same formulation of drugs, we have developed them which can be inserted through the rectal route. That means now the issue of vomiting has been taken care of, and the palatability, that means because it's just been inserted through the rectum, you're not afraid of vomiting, you're not afraid that it will have a bad taste to the child. And then, of course, it also increases what we call bioavailability, absorption. Yeah.
And we do not want to end the show before we talk about the future for malaria. Yes. But before then, let's have a look at just 2 questions. I am Jen from Nasianda. How many types of malaria do we have? And then number 2, we have, hello, what do you mean by treated net mosquito? Maybe you can take those 2
James,
first.
thanks for your question. Quickly, there are 3 classifications of malaria. There's what we refer to as uncomplicated malaria, which prevents with the symptoms that we discussed. And basically, these are the type of malaria where we use the first-line drugs, the one I'm referring to as artemether lumefantrine, different weight bands for different categories of weight. Apart from uncomplicated malaria, we do not have complicated, unfortunately. What we have is severe.
Okay.
Severe malaria. Now, this is malaria which has failed or was not properly managed initially, so comes up with severe. And this is the malaria that actually, kills.
Right.
Contributes to a lot of mortality, because severe malaria, management of severe malaria is done inpatiently. You cannot attend to it as an outpatient
And someone
case.
was asking whether cerebral malaria can be treated. Is it
Yes,
the severe one?
It can't be treated. It's part of the severe malaria.
Right.
That we, in fact, it was the one that now I wanted to talk about. This is when now the parasites have gone into the central nervous system, into the spinal cord, all the way to the brain. And it's very dangerous because, of course, anything getting to the central nervous system impairs, nervous breakdown and brain damage. And sometimes the severity or the complication may not be reversible.
Right.
Yes.
Okay. Then what do you mean by treated net mosquito?
Treated nets, we have different types of nets. These nets are treated with a chemical that repels the mosquito. And that's the one that we advocate for, because we have the ordinary mosquito net. If I'm living in Nyandarua or in central Kenya, where we say the prevalence is less than 1%, a mosquito will just prevent, the buzzing and the biting.
Right.
But if I live in coast region, or I live in Nyanza, for example, or the highlands of Kisii, then I must use an insecticide-treated, long-lasting, not just treated, long-lasting treated nets, because the chemicals that is used when the nets are being prepared now makes the mosquito not. I hope I've answered the question.
Yes, you have. Very quickly, maybe before we get a few questions, let's talk about the future of malaria. There's this drug, KAF156. What does it even stand for? I know it's on trial. It's meant to eliminating malaria. Yes, just let's talk about it.
WHO with other partners and stakeholders have a program that tries to eliminate malaria by the year 2030.
Yes.
And there is a recent study which was just concluded a few weeks ago. I took part of the study. It's called the Malaria study. And it's trying to see at how possible is it that we eliminate malaria by 2030. And to that end, one of the things is we have now, because of the fears of resistance, we have developed KAF156.
What does it stand for, Doc?
It's actually a code. What normally happens when we are doing the clinical trials or when a drug is still under research and development, and up and until it is approved, we give it a specific scientific code to differentiate it, because there are so many other molecules which are still, in pipeline being developed. However, what I must say is that this is a drug which we are hoping could help us, come and help us eliminate malaria.
Okay, and why are we having it? Does it mean other drugs that are available in the market are not resistance. It brings us back to the topic on resistance.
Yes, yes. I think I already mentioned that currently the medicines that we have been proven to be 98% effective.
Right.
Or with 95%, actually almost 98% effective against treatment of malaria.
Okay.
What has been coming out clearly is that due to the effectiveness of these drugs, the first-line drugs in management of malaria, there's a tendency of community complacency.
Okay.
Which is now what is contributing. We are fearing that due to the complacency, among other factors, because remember, even the mosquito develops its genetics in a way that it is able to evade the compounds that we have.
Okay.
And that's why we are having this drug on trial in pipeline, so that should we actually have documented cases of drug resistance, then what do? We have an alternative molecule which can be used. Yes.
And okay, maybe we can, before we pick one question, in maybe a few seconds, you can tell us some of the unique features. Is it meant to prevent, because the drugs that we are having, they are for treating malaria, not for preventing. Maybe is it meant for preventing malaria, or what are some of the unique features these KAF 156 will have?
I may not go into specifics because remember this is a drug which is still on trial.
Right.
And there are ethical considerations to that effect.
Okay.
But what we are looking at is, of course, improved efficacy in trying to eliminate the plasmodia.
Right.
Yes.
Okay, let's pick a few questions. Marion, at 22 years old, I feel like something is stuck in my throat and it makes me vomit a lot. Kindly help me.
Marion, what I would advise is that you quickly go to a healthcare provider in a good setting, preferably in a hospital setting. Let her be done physical examination by a medical doctor who will be able to determine. Actually, yes, there could be something there. You never know, yeah. So it's important that they go and seek help. Okay.
I am Omondi Charles from Kitale. I want to ask the doctor, how would you help a person who is already infected with malaria?
For those who are already infected with malaria, the simple answer is that malaria medicine are free in government facilities and they are available. If you've been diagnosed, then you have a prescription. The best thing to do is to take the anti-malaria drugs. And the entire course of the medication is just 3 days. And then, of course, you have to adhere to, the instructions that you are given so that it's taken care of.
Okay, another one, Amishek from Nyeri. I want to know how long can the treated mosquito net last?
The ones we have currently being distributed by the malaria control program last for up to 5 years. And that's why we call them long-lasting. And in any case, we anticipate that by the end of the 5 years, the net also starts becoming worn out, so you also need to replace it.
Right, and we have a caller from Earth River. Hello.
Hello.
Hi, how are you today?
I'm fine. I'm later calling from Earth River.
All right.
Example is my question.
Yes.
I'm fine.
Just reduce the volume of your television set. We can hear you clearly. Go ahead.
Okay, I'm asking. Why is it that sometimes when you take the AL drugs for long, it reaches a time that, for example, if you take them for long in a Somali, in a Qatar, like we take them, but you're not getting well. What is usually the problem?
Thank you so much for that question. You've heard her?
Yes, thank you. From Earth River, I think that's a very valid question.
Yes.
And it's actually one of the things that contributes to what you're calling resistance. You find that there's a lot of self-medication because these are drugs which are, over the counter. You can just go to a chemist, request, and most of our outlets, like we know, the regulation is a bit, so they can be able to access this. So you find someone has been using these drugs over and over. However, one, because they are not following the right instructions. Secondly, because we do not know which drugs they are using. Remember we talked about substandard anti-malarials which are there in the market. So it is important for that person or the caller from Earth River to actually go to a health facility or where she seeks her medical attention, have had, like, you remember the caller who called initially and they had to send the blood samples to Cambridge.
Right.
Because generally speaking, resistance does not just wake up one day and happen. This is a process. So if I'm suspecting that I'm taking medications and I'm not getting well, then it should be documented that yes, we have received a case from Athi River, we've sent their blood to Cambridge or to the National Reference Laboratories. These are the results that we are getting, that these drugs are starting to fail. But until it is scientifically proven, then, and remember also it's good to tell our viewers that if malaria is not contained within 3 to 14 days of diagnosis and initiating the treatment, then we refer to that as treatment failure. And we need to, now do more tests to find out why did they? Is it the patient was not adherent? Is the drugs, the quality of the drugs that you're getting that are not effective? So that we are able to know now what next. How do we go about it? How do we address the issue? But these cases, my advice is that let them go to, hospitals. Let them explain their case. I've taken malaria this time, I took anti-malarials this time, but still my tests keep coming positive, so that we can have documented cases which help us to come up with what we call evidence-based decision making.
Okay.
So that we are able now to know, yes, for sure, we are having drugs which are not effective, and what could be the problem.
Okay, and Doc, because you're talking about treatment failure, there are so many people going to over-the-counter drug. Is it okay to conclude that as a doctor you're not recommending for over-the-counter drugs? Because there are so many people, you go to the hospital, you just explain how you're feeling, and someone tells you it's malaria, just pick the drugs. As a patient, what are you supposed to do?
I must commend the Division of Malaria Control,
Okay.
Headed by Dr. Wakoi Jersa. There have been concerted efforts in training of healthcare workers in how to manage malaria. And they came up with the most recent guidelines in 2015 on management of malaria. And what we are saying is that we must not initiate treatment for malaria without testing.
Okay.
And the test must be positive.
All right.
Before then, we are not allowed to initiate treatment.
Okay, and as we wind up, because we are winding up, let's pick one very last question. I experienced a joint pain, headache, and backache, which subsides after taking painkillers. This month, I moved from Nairobi to Kakamega County. Could it be a sign of malaria?
Well, those are what we refer to as general symptoms. And like I keep repeating, the easiest way to diagnose malaria is to go to a health facility.
Right.
I must keep repeating that government institutions, testing and management of malaria is absolutely free. So I would encourage our viewers and the general public that let them go to any public, as low as a dispensary. The RDT testing does not take more than 10 minutes.
Right.
Yeah, and then if they are found to be having malaria, the drugs are again free. So these people need, and I think it's important that we urge our viewers to have a good health-seeking behavior.
Right.
Do not wait until it is too late, only for you to die of a disease that could have been diagnosed for free and managed for free in less than 3 days.
Right.
Yeah.
And we look forward to having more guidelines set aside tomorrow being the World Malaria Day. Dr. Kibe, thank you so much for coming to my Doctor Show.
Thank you.
We highly appreciate it.
Thank you.
That's all the time we had for the show today, but it was really informative. We appreciate it.
We hope that, it's my hope that we'll have more sessions so that
Yes.
we can be able to continue disseminating this information.
Right.
Not just to the general public, but even to share amongst our colleagues.
Well said. Thank you so much once again. That's all the time we had for the show today. My name is Purity Museo. Remember, you can always watch our previous episodes from our YouTube channel at Ebru TV Kenya, or go to my own, which is Purity Museo, and look for my Doctor Show. You'll find it right there. Thank you for your feedback. Thank you for your calls, your comments. We do appreciate my Doctor Show continues tomorrow. My name once again is Purity Museo. Do have a lovely day. God bless.